Before you ignore your next blood pressure reading, there's something you need to know, because one of those two numbers could be quietly putting your life at risk, and it's probably not the one you think. Most people look at blood pressure as routine, two numbers written one over the other, something your doctor mentions quickly and moves on. But here's the truth. Those two numbers are not equal, and after the age of 60, focusing on the wrong one can be dangerous. In fact, I've seen people who believed they were doing fine simply because one number looked normal, only to suffer a stroke or heart failure months later. Not because they ignored their health, but because they misunderstood it. So let's simplify this. When your blood pressure is measured, it's showing how hard your blood is pushing against your arteries, but your heart doesn't pump steadily. It beats in waves. That's why there are two numbers. The top number, systolic pressure, is the force when your heart pushes blood out. Think of it like a surge, a strong wave moving forward. The bottom number, diastolic pressure, is the pressure when your heart relaxes between beats, the quiet moment. So if your reading is 150 over 80, 150 is the force, 80 is the resting pressure. For years, both numbers were treated the same. If either one was high, it was considered a problem. But over time, something changed. Researchers began tracking thousands of people, then millions over many years, and a clear pattern started to appear, especially in people over 60. And what they found changed how we understand blood pressure. Let me show you what this looks like in real life. One woman in her early 70s came in feeling confident. Her lower number was perfect, well below 80. She thought she was doing everything right, but her top number? It was consistently high. She wasn't worried. No one had explained the difference clearly months later. She suffered a major stroke. Now compare that to another patient in his late 60s. His bottom number was elevated and he was extremely anxious about it. He thought a heart attack was coming. But after proper evaluation, his actual risk was much lower than he believed. Two people, two numbers, two completely different outcomes. And this leads to the most important question. If you're over 60, which number actually matters more? Because the answer could change how you look at your health forever. And in the next part, I'll show you exactly which number is the real danger and why ignoring it can silently damage your brain, heart, and kidneys without any warning. If you're over 60, the number you need to watch most closely is the top one. Your systolic pressure. Yes, the first number. The one most people ignore. The one that slowly rises with age, and often gets dismissed as normal, but it's not harmless. In fact, some of the largest long-term health studies ever conducted show something alarming. For older adults, that top number is a much stronger predictor of heart attacks, strokes, and even death than the bottom number. Not just slightly stronger, sometimes 2 to 3 times more predictive. Think about that. You could have a perfect lower number and still be at serious risk if your top number is high. And this is where things become dangerous, because many people over 60 develop something called isolated systolic hypertension, which simply means your top number goes up, while your bottom number stays normal or even drops. At first glance, this can look reassuring, but in reality, it's one of the most overlooked risk factors in older adults. And for years, even some doctors underestimated how serious it was. Now we know better. This pattern is strongly linked to stroke, heart failure, kidney disease, memory loss, and even dementia. And here's why. It comes down to what's happening inside your arteries. When you're younger, your arteries are flexible, like soft rubber tubes. They expand easily with each heartbeat, absorbing pressure, protecting your organs. But as you age, they begin to stiffen. Elastic fibers break down, calcium builds up, and the walls become rigid, more like hard pipes. So what happens when your heart pushes blood into stiff arteries? The pressure spikes. That's your systolic number rising. At the same time, those stiff arteries don't relax properly between beats, so your bottom number may stay the same, or even decrease. And this creates a hidden danger, because every heartbeat now delivers a stronger impact. Against your blood vessels, think of it like waves hitting a shoreline. Small waves, no problem, but strong waves, repeated over time. They slowly break things down. That's exactly what high systolic pressure does. Beat after beat, day after day, year after year, your organs take the damage. Your brain is often the first to suffer. Tiny blood vessels can weaken, become blocked, or rupture. Sometimes this leads to a major stroke, but often, the damage is silent. Small injuries, sometimes called mini-strokes, build up over time, and eventually, they show up as memory loss, confusion, or cognitive decline. Your heart is affected too. It has to push harder against that pressure. Over time, the muscle thickens. But a thicker heart is not a stronger heart. It becomes stiff, less efficient, more prone to failure. Your kidneys also suffer. Their delicate filtering system depends on stable pressure. Too much force damages those tiny vessels, leading to gradual decline. So this isn't just about a number. This is damage happening quietly inside your body. And the most concerning part? You won't feel it. High systolic pressure rarely causes symptoms. No warning signs, no pain until something serious happens. That's why it's called the silent threat. Now here's something important. This doesn't mean your lower number doesn't matter. It still plays a role, but after 60, it's not the main driver of risk. The top number takes the lead. And in the next part, I'm going to explain something that confuses a lot of people. Why a low bottom number doesn't always mean you're safe. And in some cases, it can create a completely different kind of risk. Now here's where things start to get confusing, because many people believe that if their bottom number is low, they're completely safe. But that's not always true. In some cases, a low diastolic number can actually signal another hidden problem, especially when it's paired with a high top number. Let's simplify this. When there's a large gap between your top and bottom numbers, it's called wide pulse pressure. For example, if your reading is 160/60, that gap is significant, and it tells us something important. Your arteries have likely become stiff. Remember, earlier healthy arteries are flexible. They expand and bounce back with each heartbeat, but stiff arteries don't do that. So when your heart pumps, pressure rises sharply. That's your systolic number going up. But when your heart relaxes, there's not enough recoil to maintain pressure, so your diastolic number drops. And this creates a different kind of stress inside your body. Now here's something most people don't know. Your heart actually depends on that lower number. During the resting phase between beats, that's when your heart receives its own blood supply. If your diastolic pressure drops too low, your heart may not get enough oxygen during that critical time, and over time that can lead to fatigue, chest discomfort, and even heart-related complications. So this idea that lower is always better is not completely true. What your body needs is balance. You want your top number controlled, without pushing your bottom number to low, and this is why managing blood pressure after 60 requires a smarter approach, not guesswork, not extremes. Now let's talk about what actually matters. In general, a healthy blood pressure is below 130/80, but after 60, the focus shifts. Doctors pay much closer attention to the top number, keeping it below 130, or at least below 140, depending on your condition. For some people, lower targets may help. For others, especially if you're dealing with multiple health issues, going too low can create problems. This is why blood pressure isn't one size fits all. Your numbers have to be understood in context, your body, your lifestyle, your health history. But here's the one thing you should always remember. If your top number is consistently above 130 and especially above 140, it's not something to ignore, even if your bottom number looks perfect, because that top number is the one causing long-term damage. That's the one increasing your risk quietly, and that's the one you need to take seriously. Now, the real question becomes, what can you actually do about it? Because understanding the problem is one thing, but controlling it is where everything changes. And in the next part, I'm going to show you simple science-backed steps that can help bring that top number down naturally and protect your heart, brain, and overall health long-term. Now let's focus on what actually matters, what you can do starting today to bring that top number down and protect your body long-term. Because here's the good news, even small changes can make a real difference. And in many cases, they work faster than people expect. Let's start with something simple. Sodium. Most people don't realize how much they're consuming. It's not just the salt you add, it's hidden in packaged foods, sauces, canned meals, and even bread. And this adds up quickly. For someone with high blood pressure, reducing sodium alone can lower your top number by 5 to 10 points. That's significant. So start small, cut back on processed foods, check labels, aim for around 1,500 to 2,000 milligrams per day. Next, weight. You don't need drastic changes. Even a small reduction can help. Losing just 10 pounds can lower your systolic pressure by around 10 points. That's a major shift from one simple change. Now, let's talk about movement, because this is one of the most powerful tools you have, and it doesn't require intense workouts. Walking, swimming, cycling, just 30 minutes a day. That's enough to improve circulation. Keep your arteries more flexible and gradually bring that top number down. And here's something many people don't realize. Exercise doesn't just affect weight. It directly improves how your blood vessels function. Next, alcohol, even moderate intake, can push your numbers higher over time. So if you drink, keep it limited. For some people, reducing alcohol alone makes a noticeable difference. Now, let's talk about something that often gets ignored: stress. When stress becomes constant, your body stays in a state of alert. Hormones like cortisol and adrenaline stay elevated, and that keeps your blood pressure up. So simple daily habits matter here. Deep breathing, short walks, quiet time. Even a few minutes of stillness. These moments help reset your system. Now here's something important to understand. For many people over 60, lifestyle changes alone may not be enough. And that's okay. Medication is not failure, it's support. A tool that protects your body, because as arteries stiffen with age, extra help is often needed. Some medications relax blood vessels. Others remove excess fluid. Some reduce the workload on your heart. And in many cases, a combination works best. What matters is finding the right balance for you. And if something doesn't feel right, don't stop on your own. Adjust it with your doctor. There are always options. Now here's something that can change everything. Monitoring at home. Because your blood pressure isn't static, it changes throughout the day. That's why a home monitor is so valuable. Check it in the morning. Check it again in the evening. Write it down. This gives you clarity, not guesswork. And finally, consistency. This is where most people struggle. Skipping doses, forgetting routines, stopping too soon. But blood pressure control isn't about being perfect. It's about being consistent. Because sudden spikes caused by inconsistency can be more dangerous than steady, slightly elevated levels. And in the next part, I'm going to clear up some of the biggest myths that stop people from taking action, including why feeling fine doesn't mean you're safe and why waiting for symptoms could be the biggest mistake you make. Now, let's clear up some of the biggest misconceptions, because these aren't just harmless beliefs. They're the reason many people wait until it's too late. Let's start with the most common one. I feel fine, so my blood pressure can't be that bad. This is one of the most dangerous assumptions you can make, because high blood pressure doesn't usually come with symptoms. No pain, no warning, no clear signs. That's why it's often called the silent killer. Damage builds quietly, over months, over years, without you ever noticing. And then one day, a stroke, a heart attack, sudden memory loss. For many people, the first symptom is the event itself. So feeling fine doesn't mean you're safe. It just means the damage hasn't reached its breaking point yet. Now, here's another belief people hold on to. My parents had high blood pressure, and they lived long lives. This is something called survivor bias. You're seeing the few who made it through, and not the many who didn't. For every person who lived into their 80s with uncontrolled blood pressure, there are many others who suffered strokes, heart failure, or died earlier. We just don't hear those stories. But the data is very clear. Controlling high systolic pressure reduces the risk of stroke, heart attack, heart failure, kidney disease. This isn't theory. It's proven. Now here's another one. Blood pressure rises with age, so it's normal. Yes, it's common, but common doesn't mean safe. There was a time when this was widely believed, but modern research has shown the opposite. Even in people over 80, managing blood pressure properly reduces risk and improves quality of life. Now, balance still matters. We don't want levels to drop too low, especially in frail individuals. But that doesn't mean ignoring high numbers. It means managing them correctly. Now, let's talk about something many people worry about. I don't want to take medication for the rest of my life. That's understandable. No one likes that idea, but think about it differently. If a small daily habit could help prevent a stroke, protect your independence, and give you more healthy years, is it really a burden, or is it protection? Medication isn't replacing your body, it's supporting it where it needs help the most. And finally, this is the most dangerous mindset of all. I'll deal with it later, next month, next year. When things slow down, but high blood pressure doesn't wait, it keeps working silently. Every single day, every heartbeat adds more strain, more pressure, more damage, and time is the one thing you don't get back. So now I want to ask you something. Be honest. Do you know your last blood pressure reading? And more importantly, do you know what your top number was? Let me know in the comments, because awareness is the first step to protecting yourself. And if you want to take control of your health even further, watch the next video on your screen, because what you do daily can either lower your risk or quietly increase it. Now let's bring everything together, because at this point, you don't just need information, you need a clear plan. Something simple, something you can actually follow. So here's what to do starting today. Step 1. Know your numbers. If you haven't checked your blood pressure recently, do it this week. Better yet, get a home monitor, because one reading at the doctor's office doesn't tell the full story. What matters is your pattern. Step 2. Focus on the top number. This is the shift most people miss. If you're over 60, your systolic pressure, the top number, is your main warning sign. Above 130, pay attention. Above 140, take action. Even if your bottom number looks perfect, don't ignore it. Step 3. Start with simple habits. You don't need extremes. You need consistency. Reduce sodium. Move your body. Maintain a healthy weight. Limit alcohol. Manage stress. These are not extras. They are your foundation. Step 4. Take medication seriously. It's prescribed. This is not a weakness. It's protection. And consistency matters. Missing doses or stopping suddenly can be more dangerous than staying stable. If something feels off, adjust with your doctor, but don't ignore it. Step 5. Track your progress. Morning, evening, write it down, because when you can see your numbers, you understand your health. You're no longer guessing, you're in control. Step 6. Stay consistent. Not perfect. Consistent, because blood pressure isn't something you fix once. It's something you manage day by day. And those small daily habits are what protect your heart, your brain, your independence. Now, let me say something important. There are thousands of people right now walking around with high systolic pressure, feeling completely fine, assuming everything is okay until one day it isn't. A stroke, a heart problem, a loss of independence. And the hardest part? It could have been prevented. But here's the difference. Now you know. You understand what most people don't. You know which number matters. You know the risk. And you know what to do, so don't wait. Check your numbers, take action, stay consistent. Because your heart has been working for you every second of your life. Now it's your turn to protect it. And I want to ask you something. When was the last time you checked your blood pressure? Let me know in the comments, and if this helped you, share it with someone you care about. Because they might be focusing on the wrong number too. And that one small shift could change everything before you move on. There's one final thought I want to leave with you, because this might completely change how you look at your health from today forward. Most people don't realize this. Managing your blood pressure isn't just about avoiding disease. It's about protecting your independence, your ability to think clearly, to remember names, to enjoy conversations, to live life on your own terms, because the real danger of ignoring that top number isn't just a statistic. It's what it slowly takes away your clarity, your strength, your freedom. And it doesn't happen all at once. It happens quietly. Little by little, until one day, things feel different, harder, more limited. And by then, the damage has already been done. But here's the powerful part. This is one area of your health where you still have real control. You can influence it, you can improve it, you can protect yourself, and it doesn't require anything extreme. Just awareness, consistency, and the decision to act early instead of waiting. Because the people who stay healthy into their 70s and 80s aren't just lucky. They pay attention to the right things at the right time. And blood pressure, especially that top number, is one of those things. So the next time you see your reading, don't just glance at it. Understand it. Respect it. Take it seriously, because now you know something most people don't. After 60s, it's not the bottom number doing the most damage. It's the top one. The one that rises quietly. The one that gets ignored. The one that can change everything if left unchecked. But it doesn't have to. Because now you're aware, and awareness puts you in control. So use it. Take action. Make decisions today that your future self will thank you for. And before you go, if this helped you even a little, make sure you stay connected, because there's so much about your health that isn't being explained clearly. And that's exactly what we're here to change. Your health journey doesn't end here. This is just the beginning.